Good morning. Welcome to the second day here at Connecting Michigan for Health. I'm Larry Wagenknecht. I'm the Chief Executive Officer of the Michigan Pharmacists Association, and I serve, that's my day job. And then in my other role, I serve as Chairman of the Board for MiHIN. Certainly want to thank all of you for taking time out of your busy schedules to come to Lansing. How many non-Lansingites or non-Michiganders do we have in the audience? If you'd raise your hand. Okay. Just want to let you know that the weather that we've had yesterday and today is how it is here all the time, all the time. So we're glad that you're here. We certainly do want to thank all of the sponsors that are supporting the conference, and hopefully you'll spend some time in the exhibit area as we go through the day today. Couple of things that you need to know that are important. Certainly those of you who were here yesterday, this is old hat, but for those of you who are joining us today, the bathrooms are out the door in the back and to the left. We certainly encourage you that you, in the downtime, that you do spend some time networking. One of the most valuable aspects of this program in the past, and again this year, is our ability to connect. Not everyone in the room is a technology person. There are some practitioners in the audience. There are people from different areas, and it's a very unique and valuable time that you can spend networking. Lastly, in the event of some kind of a disaster, it's out the doors and that away. So that's we've dealt with that. One of the things that at MiHIN, when I was contemplating the opening session this morning, trying to think about where we've been, and about 10 years ago, there were a group of policy folks here in Lansing that got together and really tried to try to think about what health information exchange might look like in Michigan. And I can say today that it's much different than what we all thought about the day in the Michigan Health and Hospital Association boardroom when we were kind of brainstorming and trying to think about what it might look like. But I think even though it's changed as far as the role of some of the regional health exchanges, the number of them, at the one point in time it was even a regional medical provider areas, and we were really struggling with how do we handle all of that and what Michigan might look like. But there's some key elements that have continued through that, and I think that those key elements are the fact that we are progressing. We are now providing some information that years ago no one thought would be possible. Each one who is here, some of you might be here because of your employer who said you need to go to this. But I know there are a number of individuals in this room today that have a real passion to try to get it right and to try to provide some information that previously wasn't available. I know there are physicians in the room today who struggled because they didn't have information that they knew was out there. They just didn't have their hands on it. I know that there are individuals here, just like David Bennett yesterday, who was talking about cystic fibrosis and how utilizing some of that information has changed his son's life. I know I have a personal connection that drives me in this process. I lost a son to cancer when he was 5 years old, and there were two separate times that he underwent additional tests. One of them was an extra bone marrow aspiration because the information was lost. And so we all have reasons and passion to be here to try to figure out how do we, in fact, get the information for the clinicians and the practitioners to make the best decisions that they can make. And it's with that passion that I think that we've really, here in Michigan, have driven forward. And we've got a long way to go. As we heard yesterday, and as many of you realize, it's not perfect. There are a lot of challenges, but we're certainly making progress. And so with that, I'm very pleased and honored that here in Michigan, we've been able to bring in the number of speakers that we had yesterday and today. I think that you'll find the day hopefully to be rewarding, and hopefully that you'll have opportunities to make some new connections. So let's get started with the program itself. It's my honor to, in fact, introduce our first speaker this morning, Dr. David Kendrick. Dr. Kendrick chairs the Department of Medical Informatics at the University of Oklahoma School of Community Medicine and serves the OU Health Sciences Center as the Assistant Provost for Strategic Planning. Dr. Kendrick is the Principal Investigator and Chief Executive Officer of My Health Access Network, Oklahoma's nonprofit health information network, which ensures that every Oklahoman's complete health record is securely available where and when they need it for the care and health decision-making for the patient. My Health serves more than 3 million patients and is focused on improving health in Oklahoma and beyond by implementing a community-wide infrastructure for healthcare IT. Dr. Kendrick is a member of the Board of Directors for the National Committee for Quality Assurance, the Strategic Health Information Exchange Collaborative, the Network for Regional Healthcare Improvement, the Advisory Board to the Sequoia Project, and convening faculty for the Comprehensive Primary Care Program. Dr. Kendrick served as Senior Counsel for the Interoperability to the National Coordinator for the Health IT and continues to work closely with the Office of the ONC. With that pleasure, it's my pleasure to introduce Dr. Kendrick.
Thank you.